It started out with just unintentional weight loss and fatigue. Mr. S ignored these signs as he was still able to work and because he knew that seeing a doctor would be expensive. He was an immigrant in his 40s who came to the US with dreams of a better life for him and his family. He juggled multiple jobs as a store clerk, construction worker, and rideshare driver to survive and pay for food and shelter. Over the years, Mr. S's symptoms progressed, and he became so short of breath that he could no longer work or stay alert. That was when he finally presented to the hospital, and I met him as a medical student on the team. I spent the afternoons getting to know his story. We connected over our family's immigrant backgrounds, and he shared his love of his family and his dream for his daughter to be able to go to college if she wished. Imaging showed that he had a type of cancer that few people die from, but because he had not been treated earlier, his cancer had spread to other organs. I cried alongside him and his family as we learned that his prognosis did not look good. Together, we agreed that we would try to get him a cancer drug that had the potential to improve his condition, but there were no guarantees. He died before he was able to get the cancer drug. Like all the other times with other patients, I struggled to process his death. This was not fair. Why him? Mr. S's story is not the story of one patient, but rather the anonymized and composite true stories of the many patients I see as a medical student. I am not allowed to share the details of any one patient's story due to HIPAA laws. Mr. S is only one of the 38% of US adults who postponed healthcare due to financial constraints in 2020. Although not all outcomes are as severe as Mr. S's was, it breaks my heart that I often see my patients suffer from preventable adverse outcomes, ranging from strokes to emergently high blood pressures, because of lack of access to healthcare.
I wanted to be a part of the change.
I volunteered with MedLife, medicine, education, and development for low-income families everywhere. Worldwide, approximately half of the world's population cannot access essential health services, and many are pushed into poverty from paying for healthcare, according to the WHO. In Peruvian and Ecuadorian communities, I worked alongside local healthcare providers, volunteers, and community workers to administer essential healthcare to hundreds of patients at mobile clinics, build vital infrastructure, and impart education. I have also helped to fundraise $10,000 over the years and grew MedLife at Indiana University, my alma mater, from a few members up to 200 members. As I learned more about healthcare access in medical school at Johns Hopkins, I realized that I wanted to not only care for and advocate for individual patients, but I also wanted to do more for my patients by helping to change the healthcare system. Some experts say that medical technology advances account for 1/2 to 2/3 of annual spending increases, but technology also has the potential to reduce healthcare costs and in turn improve healthcare access. I aspire to create cost-effective, eco-friendly healthcare solutions, resulting in my co-inventorship on the patent of Novocup, a novel, easier-to-use menstrual cup design that retains the cost-effective and eco-friendly benefits. We also raised some funds to provide free menstrual products and menstrual education. Our goal is to enhance accessibility to menstrual products while providing menstrual education. $210 billion in healthcare spending in 2013 has also been attributed to unnecessary services, making it a large source of unnecessary costs for the patient, as well as the greatest contributor to waste and a contributor to lack of healthcare access. To address this, I co-created a free year-long curriculum on high-value care, fostering effective healthcare delivery at the right cost by eliminating wasteful practices. This initiative reached 297 medical students across the nation, empowering them to shape the future of medicine. Finally, access to healthcare is highly influenced by policy, so I volunteered with the Center for Medicare and Medicaid, raising awareness about palliative care coverage, the type of medical care that eases symptoms of serious illness. I lobbied at the White House, partnering with the American Medical Association to address the physician shortage and expand access to care. As Miss World America Maryland, I will continue my fight towards a world where everyone has access to quality health care. This is for my patients, like Mr. S, so he could have survived to see his daughter go off to college. And it's for all the people in the world to have the foundation of health to fulfill their dreams.